famous medical universities in Russia, among all universities, healthcare, Ministry of Healthcare and Ministry of Education. So currently we have more than 4,200 international students and more than 12,000 local students. Apart of this, we have more than 2,000 postgraduate students, PhD fellowship residents. We have our own hospital, affiliated hospital for 750 beds with robotic surgery, oncology, and most of the famous department. We have amazing teaching facilities.
Seen that there had been, rumors, or maybe you can say there's a lot of on media that there has been a situation of war in Russia, and parents and students are quite scared about it. So could you please help to brief about the situation in Russia and
The situation in Russia is quiet, safe and sound, and my office is also safe and sound. You just arrived safely, and we just a few minutes ago discussed kindness and hospitality of Russian people, same as Indian. Rumors are called rumors.
Absolutely.
It's not true.
Yes, absolutely. And one more thing, there had been a question there in students' mind, like how about the clinical exposure? Do we get to work on cadavers, or how does it work? Could you please explain them and brief them, like how does it work here?
Of course, we were the first medical institution who finished with these online things, even during COVID period. We transferred our education to practical part even during the COVID era. Currently, we inviting and we are going to finish invitation process, and students immediately will proceed to this real life situation. From the first year, they will work, of course, and study anatomy on cadavers.
So as per the NMC Gazette, it says that all of the medium of study should be in English. So here we know that all the lectures and exams, everything is in English. But what do you say about the clinical exposure? Like by when they start, and do they need to know Russian, or would they struggle if they don't know Russian? Because that is the fear again in the students' mind, that Russian is mandatory. Like what is your message to the students about that?
Yes, Russian language is necessary if you study in Russia, if you study in China, Chinese, if you study in our country, in Arabic country, Arabic, because you must be able to communicate with patients. But as you said correctly, medium of studies are absolutely English, lectures are fully in English. One example, during COVID, we gave opportunity to students for work. If you want to be hired in hospital, in Russian hospital, what they will ask you first? Your skills, your knowledge and language.
Absolutely.
And those who were familiar with Russian language, they got salary. And this salary is not little.
Yeah, quite high. And how about the clinical exposure? Like by when the student starts their clinical exposure?
From the first year.
Really?
From January, yes. They will have first, this also my famous medical commission, this gazette, they're asking 12 months of clinical exposure. And a part of these 12 months, which we have on 6th year, every summer they have clinical exposure, and from this January they will have also clinical exposure, first clinical practice. Because of late arrival, we will shift this January part to April, and they will have clinical exposure in April and July, but from the first year. They will start from nurse assistant's practice, after nursing practice, junior doctor, etc., etc. We call this clinical placement or clinical clerkship.
Yeah. And how about the hostel accommodation? Like there had been a lot of concerns from Indian students that the hostels are not really good, or they have been given a hostels where they are not able to stay? Like, how are we resolving? How are we balancing out like the number of admissions with number of accommodations, or
Till now, our students are not sleeping in snow, on ice. Everyone got the place, everyone got the hostel. First concern, the hostel is not 5-star hotel. So the hostels are same hostels as in the United States. In United States, the rules, the number of square meters, much less, and rules are like in army. Russia is free country, and students unfortunately feel this and misbehave, overuse this, and this is the result.
Thank you so much, sir. Thank you so much for your time. It
Thank
has
you.
been, you have given a lot of your precious time, and we have been.
Thank you
So,
very
thank
much.
you so much.
Hope to see you again.
Yes, sir.